Welcome to the Healthier Tech Podcast, the show about building a healthier relationship with modern technology. Now here are your hosts, R. Blank and Stephanie Warner.
Dr. Josh Emdur is not your average physician. With his expertise and passion for improving the efficiency in the delivery of primary care, he has become a pioneer in the field. As a 50-state licensed physician leader, he firmly believes that everyone should have access to healthcare that is not only convenient and affordable, but also delivers high value. He spent over a decade treating the sick within the hospital walls. It was during this time that he came to a profound realization. True health is achieved outside of the hospital, and he made it his mission to transform the way primary care is provided. He's currently the Chief Medical Officer at SteadyMD, where he launched the world's first virtual primary care practice specifically tailored for runners. Leveraging technology and focusing on preventative measures, he has bridged the gap between healthcare and wellness. Welcome, Dr. Emdur, to the Healthier Tech Podcast.
Hey, thanks for having me. Really excited to talk about this topic that's so near and dear to my heart.
Yeah, no, there's a lot here that I find interesting that I want to get into. As I was prepping for the episode, actually, we'll start right actually with one of the first questions that kind of popped in my head, which is, what is hospital care and what is primary care, and what are the key differences?
Yeah, no, great question. So when I worked in the hospital, I really loved every minute of it, in that I was there to be able to use my expertise and my skills to take care of people when they were in some of the hardest times of their life, showing up after their first heart attack or a complication of diabetes. So hospital medicine is really akin to, I used to call myself a firefighter kind of mentality, where it was the emergency room's job to stabilize a patient, kind of come up with a working diagnosis. And then from there, in hospital medicine, my job was to take that handoff from the emergency room and get the patient better, and then back to their lives and back to the care of their primary care doctor to keep them healthy and out of the hospital. The second part of that question, what is primary care? I mean, in my mind, primary care really should be the first place you go for care, not the emergency room, not the urgent care, but really to that trusted medical professional that you know and knows you, to keep you healthy and out of the medical system for as long as you can.
So hospital care is about getting you out of the hospital, and primary care is about keeping you out of the hospital.
I mean, I would say hospital care is about saving your life and making sure that you can, and treating you when you're in crisis, but definitely not a place to go for primary care.
Yeah.
What I thought was always so trying was that I saw that this lack of access that people had, where they didn't have that primary care doctor to go to first, and instead they would end up in the hospital for a problem that was preventable if they would have just addressed it earlier.
I'm clearly not an expert on this, but I have heard of increased rates of people utilizing, I don't know if it's hospital care as much as specifically emergency room care, as their primary source of healthcare, because they don't have insurance, and emergency rooms are obligated to take you in by law. Am I right about that?
Yeah, you've done your homework. So there are laws in place to make sure that the emergency room sees everyone who's in the waiting room, no matter of what their payer is, no matter what their ethnicity is, whatever their beliefs are. They have to see everyone, and I'm really glad that those laws are in place.
Mm-hmm.
But the flip side of that is I see patients every day on digital health platforms where I hear of where my patients will tell me, like, hey, the last time I got my medication for depression filled was at the emergency room because I didn't have any place to go. And when we look at a societal level, that's just such a major problem, because it's making it so our emergency rooms aren't as able to care for the patients who really do need that
Yeah.
level of service.
And then who ends up, this might be too complicated to answer in just one answer, but who ends up paying for those bills, those emergency room bills?
We all do.
Through what mechanism? Through
Society.
taxes or through insurance premiums or kind of a mix or?
Oh, yeah, all of those things.
Okay.
State
definitely
funding, federal
suboptimal.
funding,
Yeah.
premiums. And at the end of the day, like the current system is, there's lots of data out there to show it that while what's going on in US healthcare is great, where people do have access to state-of-the-art procedures and care, the way that it's being delivered just isn't efficient. And there's lots of data out there showing that while we spend the most money in healthcare, we don't have the healthiest population to show for it.
Yeah, that I definitely feel that to be, it seems true on the ground level of being somebody who sometimes needs to go see a healthcare provider. It can be very confusing and not the most supportive. It seems a little frustrating, we'll say. So I wanted to ask, can you tell us more about your journey and the pivotal moment that led you to shift your focus from hospital-based care to revolutionizing primary care? And before I stop, I have to say I'm a huge fan of the shift to telecare. I think it's just it's an amazing way to provide certain levels of healthcare. So yeah.
Yeah. So like I was saying before, I loved my work in the hospital, but the part after doing it for a decade, the part that I started to lose purpose in is that I didn't have that continuity. Like I really felt like I was just there for the emergency, but wasn't really able to be a larger part of the solution to keeping people healthy. So with that, in 2017, two entrepreneurs reached out to me when they were looking for a primary care doctor who runs marathons to start a primary care practice that was completely online to take care of patients with similar interests to me all across the country. And I was like, sign me up. This sounds awesome. So that was with this company called SteadyMD, which I've been with now for 6 years. And I'm now the chief medical officer at SteadyMD. And I quickly realized, like, with that concept of linking patients with a doctor with similar interests and having using technology to communicate with that panel of patients was a way to keep people healthy using a system that was a lot different than what we're all used to, of having to call your primary care doctor, make an appointment, wait, however long the wait is to see that provider to get in. Like I realized right away
just to
that
get a referral. Yeah.
Right. I realized that this was a way to change that system. And I learned so much in that first couple of years at SteadyMD. That was from 2017 to 2020, which was like the first part of SteadyMD where we provided this service of connecting patients and doctors with similar interests.
So I heard you in this. Everything you're saying sounds really compelling. And I heard you in a separate interview speaking about how this direct primary care, is that the correct phrase, is outside of insurance. So I can see how avoiding insurance requirements is great because insurance companies are notoriously difficult to deal with, even when they actually cover you. But how does this actually work? Is the platform all out of pocket, or what is the on the financial side?
So with direct primary care, essentially you're able to cut out the middleman and have a direct financial relationship with your clinician.
Okay.
And we still operate a similar practice. It's now under the brand Lemonade Health, where patients sign up. It's like a gym. You pay a monthly fee to have access to a doctor that you know and trust. The first visit is a video visit where you spend like an hour or so just getting to know one another. And then from there, we have a chat app, so you can text message with your doctor. And you're exactly right in that it's this type of like asynchronous and text message based care for the most part isn't covered by insurances, but we're finding that people love it, both our doctors and our patients, because it just makes it a lot simpler to get patients the care that they need at the right time and at the right place, and also for the right cost. So like with that, digital health and telemedicine, like by no means is it like a panacea or a solution for everything, but it's definitely a great first stop of like, Dr. Emdur, like, what do you think of this rash? And I can just say, hey, send me a picture of it. And then I can text back, how long have you had this rash for? Oh, I don't really know, maybe like a month. And this is a true story where I looked at this rash and I was like, that doesn't really look like a rash to me. That looks like a melanoma, which is a life-threatening skin cancer. And that's what it was. And I was able to get that patient to a dermatologist to have a biopsy immediately. And then those slides went to the pathologist, those went to a tumor board, and then that went to a tertiary care center where the patient ended up having a widespread excision with lymph node biopsy, and fortunately had a great outcome. But a lot of us don't like going in to see the doctor. A lot of us don't have time. There's a lot of barriers to care.
So
and
following
I'm just trying
that
to do what
referral,
I can to figure it all out.
Following that referral, the rest of that patient's journey was through normal channels. What they used SteadyMD for was the initial evaluation and then the referral. Is that?
Yeah, you got it. And this is where it's like, I think everyone needs access to some form of professional medical guidance. Like, it's so easy for any of us, myself included, of like, just going to Google and saying like, I have this problem. What does
everything is cancer?
What does the internet think? And
right.
My patients now are so educated, they'll show up to visit with me knowing more about a condition than I do. And that's okay. I've accepted that. I mean, I know where to go to get, get information that is more clinically validated than what Google will show up. But, my patients will come to me with really, compelling evidence of what they think they have. And I'll listen to that and make sure that, we are right and we're not kind of, barking up the wrong tree, if you will. But everyone has access to so much information now, but then it's like, well, what do we do with it? What are the great next steps?
Right. I have quite a bit of experience on the patient side using telehealth, and I absolutely love it. It removed barriers for me. So it was, I went into urgent care, and it was during COVID time, like the big part of COVID time, and before vaccines, and it was getting in the door was difficult, and then I was told the expense of it. And I had already looked into the telehealth option, and it was a quarter of the price. So just walking through the door was going to cost me 4 times as much. So I, of course, was like, okay, well, let me just go do the telehealth and see what I can gain from that. And they were able to give me the insight I needed, to give me the prescriptions I needed, all for, a fraction of the cost. And I got to be home. I didn't have to wait. I didn't have to expose myself to anything. It was wonderful. And from there, I became quite a huge fan of the concept of telehealth. And my question is, so during COVID, it seems like there was a huge rise in the acceptance and use of telehealth. And now that we're kind of over that hump and people are going back into, their primary care, going into offices, are you seeing a big impact in the adoption rate, I guess, of telehealth by the facilities that do adopt it and provide it for their patients?
Yeah, great question. So going back to 2017, when I let my hospital group know that I was not going to renew my contract to pursue a career in digital health and telemedicine. At that time, my colleagues were like, Josh, like, that's crazy. Like, why would you leave, this great job to be an internet doctor? I even got a comment that will always stick with me of like, it must be nice that your wife's a surgeon, which she is, but it was like,
Oh,
my
burn.
colleagues just thought like I was just going out and doing like something that wasn't really, that they didn't believe in, that wasn't going to make a difference. Fast forward to 2021, like that same person who I consider a friend, and I don't think they meant those comments to really be
Right.
hurtful. And I'm pretty tough. They didn't hurt me, but
Yeah.
going back to 2021, like, I would get comments like I got a comment from that same person saying, well, hey, Josh, like you kind of got lucky there. Like good work with the telemedicine. And it's because with the pandemic, all of my colleagues experienced how valuable of a tool it is. Going back to 2017 again, the comments I would get was, well, how are you going to do an exam? And my response was like, there's certain things I won't be able to examine, but will that actually change my medical decision making? And there's still times where I ask myself that same question of like, is this something that I can safely evaluate, diagnose, and treat by a digital health or telehealth modality? And sometimes that answer is no. Like we need to actually get you in where someone can take a closer look at that, lay their hands on your belly to make sure you don't have any signs of an acute abdominal process that's going on. But really, to answer the question, I think our clinicians have seen the benefits of telehealth. I think our patients have done so as well. So now we're at this point of figuring out how it becomes the new normal. Like, how do we integrate it to make the whole healthcare system work better for everyone? It is true that the number of visits has gone down from the number of telemedicine visits have gone down from the COVID peak. But the future is bright for telehealth. And I think we're close to a point where the word telehealth is going to go away because it's just going to be an expected part of the system. We all live in an age of convenience. I mean, we can hop on our phone and request an Uber. We can request any kind of food we want delivered to our house. You can get pretty much any kind of service. And I think a big challenge that we are seeing now with digital health is consumers expect that same level that they get from these other the same level of service from these other industries, when the reality is we still have a clinician shortage. There's a shortage of doctors, nurse practitioners, healers out there. So now we're at this place of like, how do we make it work all around? So again, patients get the care that they need at the right time, at the right place, for the right cost.
Right. And that kind of goes into my next question, which is how have you found the rise of this telehealth has affected physicians and your kind of day-to-day life? How has it affected your ability to practice and practice more efficiently and effectively? And the other side of that is your well-being as a physician.
Yeah, no. So going back, I finished medical school in 2004, residency in 2007. Up until 2017, I never would have thought I would have an opportunity to practice anywhere with an internet connection. So that was like mind-blowing to me. And not all specialties can utilize telemedicine as much as I can now as a primary care doctor. Like some specialties are more surgical or require a lot more detailed physical exam than the technology currently provides. So that was a huge, like now that primary care doctor can get licensed in multiple states, because I still need to be licensed in every state where I start a doctor-patient relationship. now that I can work remotely, it really completely changes the job. A lot of my colleagues are able to work schedules that they were never able to work before in the clinic, where they can choose to work weekends or evenings and have more time for their kids, more time for their pastimes, to just make it so they can still practice their craft, their profession of being a doctor or a healthcare provider, but be able to do it outside of clinic walls or hospital walls is very different. And in order to like prevent burnout, I think that there's two sides to that coin. Like for me, who's someone who is kind of always very like more prone to like workaholic tendencies. For me, it's been harder to find that balance because there's almost always work to do. So with anything, like the key is to find that right balance where you feel like your work is meaningful, you're making a difference, but you're also having enough time for yourself to recharge and feel, you're living the life that you want to live.
Yeah, so I appreciate you bringing the conversation there, because what we've done in this interview and what a lot of people do when they talk about telehealth is talk about it from the advantages from the patient perspective. But I feel like what you were just getting at were some of the improvements that this can bring to the physician experience of the delivery of healthcare. We recently had on, the episode hasn't aired yet, but Dr. Sapna Shahak, who has a podcast, The Worthy Physician. And in that one, we talked a lot about not just physician burnout, but increased rates of severe depression and unfortunately suicide among the medical community. Can you touch a little bit more on what you just started talking about, which is what this method of delivery of healthcare can mean to quality of life for physicians? Because A, that matters to physicians, but B, that also matters to patients, because when physicians are in a better place, the whole experience is going to be better for everybody.
Yeah, I love that. I mean, I think a happy doctor who's in a good place will make for happier patients. Like in any human interaction, if one side of that interaction is just down and doesn't have good energy, it's really hard to have a healing relationship. But to answer your question, there's a ton of opportunity out there to use digital health in a way that say an office-based family practice doc or office-based internist, use digital health to take care of things that can be managed in seconds to minutes, and then use that time gaining to then be able to have that time for the patient that does really need to be seen in person. I've also done quite a bit of clinic work, and there's no doubt that we need to be able to support our colleagues in the clinics and in the hospitals, and that's where telemedicine can help make the whole ecosystem work more efficiently and effectively for patients.
So we kind of skipped over this part earlier. You talked about how part of the incentive for you to join SteadyMD was the opportunity to build a program specifically for runners. So I understand that you are a sub-elite marathoner.
I don't know if I'd go that far, but
oh well, that's what your publicist bio says. So
I run a couple marathons a year, and I'd say I'm like competitive in my age group. But I think maybe sub-elite would be if SteadyMD didn't get so busy, where I had more time to train. the past couple of years, it's about making sure that I'm spending enough time keeping in shape. I just ran a 10K in Boulder on Memorial Day, one of my favorite days in Boulder of the year. For any runners out there, the Boulder, such a great 10K. But with SteadyMD, it's been a super fun journey. I mean, starting out in this direct to consumer world, but with COVID, we did a bit of a pivot where we went from going to the consumers to being a company that powers telemedicine for other large companies.
Okay.
And going back to the burnout question, what we're doing at SteadyMD to help prevent burnout is we are doing a lot of different things to keep the work varied. So it's not just the same thing day in, day out, which I found really it's another great aspect of digital health that I don't think gets enough airtime, of like being able to, from work at home environment or remote work environment, you can do some urgent care, you can do other kinds of care that are just kind of different than what you'd be doing if you were going to a clinic, or working the 9 to 5 every day. Doing a mix of urgent care, primary care, remote monitoring, chat-based visits, all kinds of opportunities out there.
That's that's part of what has motivated me about, I mean, it's not directly comparable, but what motivates me about entrepreneurship is the tasks that you have from day to day or week to week are constantly shifting. And I think that's a big part of what suppresses burnout. Now there are other stressors that then introduce the potential for burnout. But what I was actually going to get to with the marathoner question is, I would think that runners, because you talked about certain types of patients, there's a lot of things where you can diagnose them remotely, but there's certain subset where you'd have difficulty and they require in person. And I would think that with runners, a lot of the issues would be more, and again, I no experience in this, but more orthopedic in nature, and thus would require that. How did you go? So the question is, how did you go about building a virtual practice designed to cater to a specific type of athlete?
Yeah. What we learned was having that common interest was a really great way to just build rapport and trust. Just being able to speak the same language. And you're exactly right in that, a lot of running related injuries are musculoskeletal problems. But once like who you're talking to, like with my runners, a lot of my patients would come to me saying, "Hey, I saw my primary care doctor. They told me to never run again. It's bad for your knees." I would say, yeah, we all know that's a bunch of baloney, and you can definitely run again, but let's figure out what's going on with your shins. How many, miles per week are you running? How often have you changed your shoes?
How are you running?
Yeah, how are you running? Like, send me a video of have your friends send a clip of you running using these 3 different views, all things that I utilized. And most of the time it was probably overuse, where they just needed some coaching of reducing their miles, maybe changing their shoes, maybe changing their stride. And, if those things don't work, it's very easy to just send for an MRI to make sure there isn't a stress fracture or a stress reaction that needs further attention.
Yeah, I love that. I think that's when it was first mentioned that you had this practice specifically around running. I was like, oh, duh, that's so genius, because and so effective and helpful for your patients, because you're going to know what some of these issues are about. You're going to understand that your knee is doing this because of this, and the example you gave, I think, is really powerful. The primary is just going to say, "Oh, running, well, that has a shelf life, duh." Where it's like, well, actually, let's just modify, and you were the person who would know that, where a primary who isn't an avid runner wouldn't know that. So I thought that was brilliant. And I kind of want to pivot a little bit We've been bringing this sort of question into a lot of our interviews these days because it's such a hot topic. How do you view AI impacting the work of SteadyMD over the next 1 year? I'd say 5 years, but the way AI is moving, I'll say 1 to 2 years, 3 years.
Yeah, love the question. There's no doubt AI is going to change all of our lives. For people who are like, oh, that's just a fad, that's never going to work, using this like really hard, definite language, like they're going to be proven wrong very quickly. I view this as a really interesting time in the history of our species, of seeing how we make it work for the good. I sure hope at SteadyMD we're able to harness AI in a way that's very safe and responsible to, make healthcare more accessible to everyone. Like how I said earlier about this clinician shortage. If we can use technology smarter to scale our clinicians to make sure that people are able to get the care that they need, I mean, I'm all for it. So I certainly hope we're able to figure out a way to make it happen. But healthcare is, it's probably the most highly regulated industry in the country. So making sure that it's done in ways that meet all the regulations and again are safe and always put the patient first.
Yeah, absolutely. And I feel terrible. I'm not going to remember the name of the person we interviewed recently, somebody who's using AI. Their business is around AI and healthcare. And I went into that interview like, ooh, I'm suspect. That's a little dubious on that. And as he was talking, it just blew my mind open on the possibilities for using AI in healthcare. And one of the things that really made me open my eyes was the ability to communicate and take notes and provide even that level of transparency between the communication, what's said in the office, being able to take that into your My Notes or whatever your medical history, your medical files, and having that, and it's not something that you have to write. Just even that small level of utilization of AI would have such a big impact on the transparency of communication and the effectiveness of the communication between physicians and patients, and greater like the holistic view of your medical history. So I thought that was really interesting.
No, I was just going to say that episode is with Dr. Harvey Castro, and that'll be out by the time this episode is released. And
Thank you.
Yeah, sorry, but just so the listeners had the reference point. Dr. Edmer, did you have a response to Steph?
Sorry, was there a question there? Maybe I missed.
No, I didn't ask. I actually didn't. I just made a very long-winded statement. There was no question. I wonder what your thoughts are, I guess, actually, no, I'm going to scratch that question. What I was thinking is it sounds like AI, like there's a lot of potential for AI in medicine. And I guess the question would be, are you planning on kind of looking at some of the opportunities with AI?
Absolutely. I mean,
Awesome.
every day. I mean, I think part of my job as a chief medical officer and as a digital health company is just reading Twitter every day, just really trying to stay on top of what all the technophiles out there are doing, because there's historically in medicine, technology has been used for a couple things. One is, the technology and surgery and to bring medications to the market, but really in the care delivery space, really looking at the electronic health record and the EMR, which was a product of the early 2000s. None of that technology was really designed to make physicians' lives easier or better. They were really tools designed for charge capture to make it work for Medicare and for payers to come up with ways to figure out how to pay for medical care, but it was never really designed as a way to save physician or clinician time. And I think that's going to be this next phase of technology in healthcare, of how do we make this all work so everyone can have access to healthcare, so we can make it so our healthcare spend as a nation isn't the majority of our GNP.
Yeah.
Because to answer to like what you guys said earlier, I mean, we're all paying for this. Our country is paying for these exorbitant healthcare costs, which really makes us less competitive as a country on the world market.
Yeah, but if we're going to make the spend, which is not, I think healthcare is a great place to spend a tremendous amount of money, but we should be healthier. And if we're not healthier, then we definitely are doing it wrong.
Totally.
So
like
Dr.
using technology to make it so to decrease costs, to make it so our healthcare spend isn't like 20% of our gross domestic product, I think is a real opportunity for winning.
Yeah, absolutely.
So, Dr. Edmer, this has been a really, it's been a really interesting conversation. I didn't quite realize even before it started the focus we would have on aspects like physician quality of life and clinician burnout. So this conversation has been great, and also went in places I didn't think it was going to in advance. Where is it that you would like our listeners to connect with you or SteadyMD?
Yeah, so feel free to visit us at SteadyMD.com. You can find me on social media. I think it's Dr. Josh Runs on Instagram and Twitter. I'm always happy to talk about burnout and how we can make healthcare more accessible to everyone. So thanks for having me on. I really enjoyed the conversation.
No, that's great. And we'll have all those links in the show notes. So Dr. Edmer, thank you so much for coming out to the Healthier Tech podcast today.
Thank you so much.
Bye, guys.
Thank you so much for listening to this episode of the Healthier Tech podcast. Remember to check the show notes for all the links and resources mentioned in the show. Please like and subscribe to the Healthier Tech podcast on Apple, Spotify, or your podcast platform of choice. Get your free quick start guide to building a healthier relationship with technology and our latest information at healthiertech.co.